All right, so like I mentioned, this will be recorded and it'll be put on YouTube. It'll be put on our website. You can see my website there, forhealinghealth.com. I also post snippets on my social media accounts, Instagram, TikTok. You can even ask questions there, on some of my health topic videos that I'll answer. Sometimes I create separate videos to answer individually. So thanks for joining the last webinar of the year. I'm pretty excited. It's been how many, 4 or 5 months of webinars, one a month. Excited to be here. Gut health is a big topic. It's probably the second most common conditions that I see in my practice after hypothyroidism and Hashimoto's. And so we've been able to help a lot of people with chronic gut related issues really by understanding basic mechanics and functionality of how the gut works in a very systemic way. And I'm going to teach you that today so you can at the very least, try to understand why you're experiencing the chronic symptoms and how you can go about isolating variables to get to feeling better. All right, here we go. All right, quick disclaimer. As always, this is just meant as informational, educational information only. Consult your doctor, physician before starting any kind of personalized supplement nutrition program. So why is gut health so important? Well, 60 to 70% of the immune system is found in the gut. We have this tissue called a gut-associated lymphoid tissue, GALT. And you can easily put that into Google and get a whole definition of what that is, but I'll give you a quick breakdown here. It is a component of the mucosa or the mucous membranes, like the lining of the internal lining of the intestines associated with lymphoid tissue or the lymphatic system, which works in the immune system to protect the body from invasion in the gut, right? So very important. It is a major barrier system to the outside world. If you imagine foods, everything we put in our mouth that we digest comes direct in contact with our insides from the outside world. So pathogens, infections, bacteria come in contact with our intestinal barrier system. And if it is strong and if it is healthy and we have a robust immune response, we can minimize illness from that. Right now, at the time of me creating this webinar, it was in 2021, and it was still in the height of the pandemic and COVID-19. And so I wanted to incorporate aspects of COVID in with the gut health, because one of the big issues we were experiencing at the time was in young kids, an issue of multi-system inflammatory syndrome, where young children tended to get less sick from COVID, less severe symptoms. But what was happening in these individuals was this condition called MIS. And a lot of the research that was coming out at the time was associating it to leaky gut, or essentially poor gut health and inflamed gut. And the healthier an individual's gut was, the less likely they were to experience severe symptoms. And there was a bunch of research articles, and you can read here. You can go through the recording of this webinar and actually read through these. But it was very, very interesting. And so it made perfect sense that a healthy gut and an intact barrier system with a healthy GALT, G-A-L-T, like we discussed, have less severe symptoms, if any symptoms at all, right? So what is leaky gut? What is this term, leaky gut? It's become more popular lately. Most of you probably have heard it once or twice by now, but in short, it stands for increased intestinal permeability. And most GI specialists do not recognize this concept as real yet, because the research that has come out around leaky gut or intestinal permeability probably has been in the last 5 to 10 years. And so anybody trained in medical school more than 10 years ago most likely haven't heard of this condition. And the other problem is, if you consider what GI specialists use to diagnose and to evaluate your GI system, it's usually a colonoscopy and an endoscopy, where they stick a camera either down your throat, down your esophagus to look at the tissues in your stomach and your esophagus, or in the colon. And in order to really understand and diagnose leaky gut, it's actually a blood test, an immune antibody mediated blood test, which doesn't typically fall in the area of GI specialists. So this is an example of a lab that I use called Cyrex Laboratories that probably is the gold standard for assessing leaky gut. And you can see the different antibodies that are checked and the different proteins. These are essentially all proteins found in the inner lining of the gut that hold the lining together. And when the lining opens and tears, those proteins leak into the bloodstream. The immune system reacts with those proteins, and we get positive antibody counts, right? So in this test, we would see, instead of all being green, we would see them in the yellow or the red. So what are common signs and symptoms of leaky gut? So you can have increased reactions to foods. That may be developing like new allergies to foods that you never really had before. Chronic GI symptoms from diarrhea to abdominal pain to bloating. Inflammatory bowel conditions, autoimmune conditions, almost all have a underlying contributing root cause of leaky gut. Chronic pain, chronic depression, chronic fatigue, multiple food sensitivities, and the list can go on and on. It is really a systemic set of symptoms that someone can experience from having leaky gut. And so what are the consequences of leaky gut? Well, we have a breakdown of the mucosal barrier, right? We spoke about that with the gullet tissue. Because all our barrier systems are intimately connected, because they have essentially the same type of tissue or cells, if we have issues with leaky gut and a leaky barrier system in the intestinal wall, we likely have issues with a leaky lung barrier and a leaky brain barrier. And these barrier systems, just like in the intestines, are designed to protect our internal environment from the external environment, right? So you can imagine things we breathe in the air come directly into our lungs, and that internal barrier system of the lungs have to be strong and healthy to defend us. When a good example of a dysfunctional lung barrier, for example, is asthma. That is a hypersensitized immune response to allergens in the air, causes inflammation, causes the bronchioles to constrict, and now restricts our airways, right? Leaky brain barrier, same concept. This is commonly seen with concussions and brain injuries and degenerative brain conditions, where the barrier system that separates what's in our blood to what's inside of our brain or our central nervous system. So this is a quick example from the same lab of a blood-brain barrier permeability screen. Again, antibodies to specific types of proteins that are found in those tight junctions that protect the brain from what's floating around in the bloodstream. All right, now this is a image of I took from a lecture that I attended. You can see the source down at bottom, Karazian Institute, great institution for functional medicine continuing education. But this is a quick summary of all the systemic symptoms someone can experience from leaky gut. And you can see, if we go straight up, you get depression, neurodegenerative conditions. If we go off to the right, you can see insulin resistance, which is essentially a diabetic or pre-diabetic state. If we go straight down, you can see we get inflammatory obesity. If we go straight to the left, we have chronic fatigue. And then, of course, down to the right, we have the contributors of autoimmunity. So it is very much a systemic set of symptoms we can experience just from a poorly functioning digestive tract and a leaky gut. So in the world of functional medicine, right, that's what we're talking about really, is we want to identify what's the underlying root cause of your set of symptoms, right? So an easy example is chronic chronic unresponsive depression. By unresponsive meaning doesn't traditionally respond well to antidepressant medications. And I showed you in the previous graph how a leaky gut or an inflamed intestinal lining can contribute to inflammation that leads to systemic issues in the brain and then depression, right? So we want to try to get down to the root cause of what those symptoms are. And we look at specifically diet and nutrition and targeting nutraceuticals and lifestyle modification to try to address as many of those factors as we can. Versus, like I spoke before, how a GI specialist really uses imaging studies like endoscopy, colonoscopy to rule out pathology. And then oftentimes, if you do have chronic gut issues that aren't necessarily immediately dangerous or red flags, oftentimes you get prescribed protein pump inhibitor medication, which are antacid medications or laxatives or stool softeners to try to regulate your GI function, which really those are only meant to be used short-term, not long-term. And we'll talk about how we can address more long-term and root cause factors. So if we break down kind of the four main root cause categories of gut issues, we have infections in the gut. And really, those are largely tested with a comprehensive stool analysis. And I can tell you, typical stool analysis that are run at a GI office are not comprehensive enough. I use a test called the GI map, which is a comprehensive stool analysis. I'll show you pictures of it in a second here. But that is a good place to start to rule out infections in the gut. There are a few infections that have to be tested with a breath test, like a H. pylori bacterial infection and small intestinal bacterial overgrowth. Typically, those are diagnosed or evaluated through a breath test that's done at the lab. Blood tests can be very beneficial. I just explained to you how the leaky gut test is largely is a immune-mediated blood test to rule that in or out. But there are secondary contributors of gut issues that may be found on a traditional blood test, like liver or gallbladder issues that could contribute to GI-related symptoms. Autoimmune diseases, for example, celiac disease, Crohn's disease, ulcerative colitis, which are all autoimmune diseases of the colon or the small intestine. And then a brain-gut axis issue, meaning the brain and the digestive system are intimately connected through a set of nerves. And that connection, if it becomes disrupted or breaks, we can have gut issues directly being caused from a brain issue. And this can be seen with oftentimes with concussion patients who never recover. And so the only way to really properly evaluate that is through a physical exam, actually checking certain reflexes and responses physically to see if they are there or they're not there. An easy example is listening with a stethoscope to the stomach and the intestines. We should be able to hear sounds of movement and peristalsis of the intestines, which is contraction and relaxing. We should be able to hear your stomach grumbling or making noise if it's hungry. Those should be heard. And if you never hear sounds coming from your digestive system or your stomach, then that may be a sign that your brain-gut axis is broken or not working appropriately. So here's the real meat and potatoes of this webinar. This is going to allow you to really understand well in a very systematic form how the digestive system works and where you may be having your breakdown, right? So all digestion starts, of course, in the mouth with chewing. We swallow, food comes down the esophagus and then lands in the stomach. In the stomach, we have the cells that produce hydrochloric acid. This acid is very potent and very strong. It has to be strong to keep the stomach sterile. It is our protection against food poisoning, right? The stronger our stomach acidity is, the more sterile environment our stomach can have. If we were to swallow a nail, our stomach acidity should be able to break down that nail. That's how strong it has to be. Now, if you consider that GI specialists, their number one prescribed medication is protein pump inhibitors or antacids, basically what they're aiming to do is control your reflux symptoms with an antacid, and they say you have too much stomach acidity. Well, that's not really the case. The acidity we have is there for a purpose. We need it to be very acidic to have a healthy functioning digestive tract. Protein pump inhibiting medications were never meant to be taken long term. They're only a short-term relief until you really fix the underlying problem. However, in medicine today, those medications are often taken for years and years and years, and we often see secondary side effects years later from prolonged use of these medications. Bacterial overgrowth issues, IBS issues, prolonged use of PPI medications causes nutrient deficiencies that directly links to dementia. And so the list goes on and on. These medications are not meant to be taken long term. So if the issue isn't too much stomach acidity, then what is it? Usually it's not enough stomach acidity. So if you don't produce enough hydrochloric acid, you eat food, the food doesn't fully digest, and from the stomach, it dumps into the small intestine. Because it hasn't fully broken down with enough hydrochloric acid, when it dumps into the small intestine, you have still chunks of whole food in there that start to ferment and rot. That rotting and fermentation creates gas that will either trigger bloating for you, or that gas comes up your valves, and then you get the reflux type of symptoms. Okay, so one of the most common ways we address chronic reflux or GERD, gastroesophageal reflux disease, is by improving stomach acidity. And there are supplements over the counter that are pretty cheap that can do this, but there's a very specific way we do this in the office with patients. But common symptoms of low HCl: poor digestion of meat and protein. Classic side effect we'll hear is, or symptom we'll hear is, oh, I eat a steak and it feels like a brick in my stomach. It just sits there and it doesn't digest. That's pretty typical. Meat and fat really need a lot of hydrochloric acid to break down, to be absorbed and eaten and digested, I mean. Bloating issues, increased food reactions, reflux-like symptoms. And common causes of not producing enough hydrochloric acid can be a high carbohydrate, high sugar diet, a high processed food diet. That bacterial infection, H. pylori, that we spoke about, that directly causes a decrease in your potency of acidity in the stomach. Antacid medications, chronic stress, and hypothyroidism. Okay, so from the stomach, like I mentioned, food dumps into the small intestine, and that's where the pancreas and the gallbladder start to chip in and help. The pancreas releases digestive enzymes that help digest carbohydrates and fiber. And the gallbladder releases bile to help break down fat and protein even further, more specifically fat than protein, to really break it down further to absorb those fat-soluble vitamins that are so important. Your vitamin A and D and E and K are all the fat-soluble vitamins that are very, very important to the immune system and to overall health. If we don't have a good functioning gallbladder, we don't digest, break down those fats, we don't absorb the nutrients. All right. Now, the kicker here is the trigger that activates release of enzymes from the pancreas and bile from the gallbladder is potent enough stomach acidity. So if we have an issue upstream with low or poor hydrochloric acid production, now we have another problem, more problems downstream in the small intestine with not being able to tolerate starch or fibers and carbohydrates, or not being able to digest or tolerate fatty foods. Okay. Now, common symptoms of breakdown in the small intestine: lower abdomen bloating, fiber intolerance, diarrhea, constipation, abdominal pain, reactions to wheat, gluten, dairy, pain in the right upper quadrant of your abdomen, like right under the rib cage on the right side or on the left side, right? Because that's where your liver, gallbladder, and your pancreas live. Causes of this is going to be poor pancreatic enzyme release, poor bile secretion, dysbiosis, so an imbalance of the good and bad bacteria in the small intestine, infections, parasites, autoimmunity like celiac disease. It can cause issues in the small intestine, leaky gut, breakdown of the brain-gut axis, and again, hypothyroidism. Makes sense. Now, in cases of small intestinal bacterial overgrowth, because this is a becoming a very common issue, and I follow a lot of these support groups on Facebook for SIBO, and the stories are so sad that people share. They've suffered for years and years and years and years, and they don't get better, or they do a treatment, they get better short term, and then they get worse again, and their SIBO comes back. And many times it is because function of the digestive system is not being treated all the way upstream. It's just being treated at the small intestine level. If an upstream issue is causing or caused the SIBO in the first place, just addressing the SIBO with antibiotics or antimicrobial supplements, but never addressing, for example, in this case, stomach acidity, the SIBO will likely come back. Or if your gallbladder is not working, it's not creating bile, or maybe you had your gallbladder removed, you need to be supplementing bile with every meal. If that's not addressed, and that was the main cause of your SIBO, now it'll recur because of that mechanism, right? So we take a very mechanistic approach to assessing the digestive tract, and this is often why treatments for SIBO fail. All right, so let's move on. In the large intestine, common symptoms: diarrhea, constipation, abdominal pain, bloody stool, reactions to wheat, gluten, dairy. Causes dysbiosis, so imbalance in good and bad bacteria, infection, parasites, autoimmunity like ulcerative colitis, things like that, and then immune reactions to foods in the large intestine. After food dumps into the large intestine, then we have a bowel movement, right? So this is systematically how we look at the digestive tract, and we try to pinpoint where your breakdown is. Now, you can have breakdown in multiple areas, which means we have to address multiple mechanisms at the same time. All right, so labs, like I spoke about earlier, comprehensive stool analysis is something we sometimes use. That's called a GI map, comprehensive blood work. I'll give you a case study at the end of this webinar on a case study of where blood work actually showed us what was happening with this chronic diarrhea case. The physical exam, we mentioned about listening to gut sounds in the stomach and the intestines. Absence of a gag reflex can also be a sign of a breakdown of the brain-gut axis. And then comprehensive autoimmune testing. So this is an example of the GI map. Now, I couldn't provide the whole test results because it's like 4 or 5 pages, but I wanted to express the difference between what a GI doctor would order as a stool analysis versus a complete functional assessment of a stool analysis. So you can see here, this test gives us a breakdown of how much fat is found in the stool, how much fiber is found in the stool, right? If there's too much found in the stool, that means it's not being digested and absorbed. So that gives us a hint as to where breakdown might be further. In this case, you can see the second word at the top, elastase 1. You can see how it's flagged pretty low. That tells us that pancreatic enzyme release is not very good. It's not very efficient. So that gives us an indicator of, okay, potentially a pancreas issue. But we still have to look upstream. Remember, hydrochloric acid dumping into the small intestine is what triggers activation of the pancreas. So we have to look upstream still. If you look at the bottom there, secretory IgA, anti-gliadin IgA. Anti-gliadin IgA refers to gluten and wheat reactions to foods. So this is a perfect example of someone who mentioned she was gluten-free. However, the stool test showed otherwise. She was still being exposed to gluten, or at least gliadin, which they're both found in wheat anyways. And so she was still having an immunological inflammatory response to these foods. So we have to take a really in-depth look at what her eating habits are, what she's eating, and try to cut those foods out. These are the parasites that get tested on this GI map, which is a lot more comprehensive than any GI doctors usually order. Typically, a GI doctor will order the typical ones: E. coli, Salmonella, Giardia. Those are the common infections. This, as a standard, the GI map tests a whole set of parasites and worms and bacterial infections. So that's an example there. These are the bacterial pathogens here, and it even goes through yeast infections or yeast overgrowths in the gut. Just like we have SIBO, which is small intestinal bacterial overgrowth, we also have SIFO, which is small intestinal fungal overgrowth, which can also wreak havoc on your gut in all types of symptoms. All right, so what can you do at home right now? Ensure good foundation of proper digestion. Number one is going to be take a deep dive into what you're eating and how you're eating. Cutting out refined carbohydrates and sugars and processed foods. By processed foods, I mean usually anything that's packaged and pre-made. Eat more veggies and fermented foods, assuming they don't cause you more symptoms. There are certain bacterial conditions that when you eat fermented foods or veggies, we could say, quote and unquote, healthy foods, you feel worse. That's almost always a big indicator of some sort of bacterial or fungal overgrowth in your gut contributing to that. That's not a normal response to those foods. So we have to clean out the system. We need to kill off the overgrowth and then rebuild your barrier system. And then we test slowly the veggies and fermented foods again to see if you tolerate them better. And usually people do tolerate them better after we've cleaned out and reset the gut. Try to isolate where in your digestive system breakdown is occurring. So I just gave you the systematic breakdown of how you can assess digestive system and potentially pinpoint where your breakdown is. Keeping a food journal can be very beneficial. So you log what you eat, and then you know what symptoms you feel after that. After a week, you try to review and see patterns. Oh, every time I eat rice, I feel really bloated afterwards and I don't feel well. Or every time I have a piece of toast or bread, you don't feel well. Whatever it may be, right? It could be immunological reactions like, oh, I eat cheese and dairy and I get really brain foggy and gassy, right? So that's the value of having a food journal. It doesn't have to be done forever, but oftentimes it allows you to reflect back on what you've eaten for the week and how you felt afterwards and pick up on patterns or trends, right? So after you keep a food journal, right, and you do some assessments of habits of what you eat and how you feel after you eat them, you can ask yourself, do you also feel any burning or reflux after certain foods? Reflux can be triggered by inflammatory foods that your system does not tolerate well. Do you experience, we spoke about bloating, but do you experience bloating after certain meals but not others? Or brain fog or fatigue or even physical pain can be driven by an inflamed gut. So what we do in my office is, without knowing anything about you, these are a common set of supplements that we start people with to try to rebuild their gut, heal their intestinal lining and the leaky gut, and then strengthen and fortify the barrier systems. You can save this link and I'll post it in the chat. Actually, if you can take a screenshot or write this down, that'd be best. I'll send it out as part of the email later. But this link will send you directly to this page where you can see the top recommended supplements that I use, at least at a baseline level for chronic GI issues. GI Revive is a leaky gut repair powder. L-glutamine coupled with the GI Revive works very well for, again, for the leaky gut barrier system and rebuilding, or we could say plugging the holes in that leaky gut. This is your hydrochloric acid supplement. This is taken, like I mentioned, usually taken with every meal. Just as you start the meal, you take it. It helps increase potency of the acidity of your stomach so that you improve digestion. You'd be amazed. I'm still amazed, actually, at how many people we've been able to address their chronic bloating and food allergies and food reactions that they have just by improving their hydrochloric acid production, because it affects everything downstream. And so you don't want to use this if you have a history of ulcers or have a current ulcer. There you want to focus on the GI Revive and the glutamine powder. There's herbal products and minerals in both of those that help heal ulcers. But you definitely don't want to take this, or if acidic things in general, like apple cider vinegar, causes you more burning, you have to spend some time healing the leaky gut first and then transitioning onto the hydrochloric acid. And then we use a basic probiotic. This is 100 billion per capsule of a dosage. We usually dose maybe 1 or 2 a day with meals, but this helps refortify the good bacteria and kill off the bad bacteria. Now, of course, there are special exceptions, cases of IBS, IBD, SIBO, SIFO. If you do have a known infection, either a parasitic infection or a bacterial infection, and it's confirmed on a test, there are different products that we use to try to kill those off specifically. I won't get into those because those are based on case by case basis. But this is a good general list of supplements most people can take without risking any side effects. Again, that link will take you directly to the store when you'll see these 4 products specifically listed, and I listed those just for you all. So let's go through a couple case study examples just to really hit this home, this concept. So what was this? Probably over a year ago, I had a woman, 50-year-old female, come in. Her main complaint was just chronic diarrhea multiple times per day. It was so bad that she never wanted to go anywhere unless she knew she was in close proximity to a bathroom. So you can imagine how stressful that is. It started to create pretty severe anxiety for her, because even she would go to church and she would have to sit closest to the exit to get to the bathroom in an emergency. That's how bad it was. And so she was stuck. When she came to see me, she was stuck in this vicious cycle of anxiety would provoke her diarrhea, but then her upset stomach and the diarrhea would also provoke her anxiety. And so it was this vicious cycle feeding into itself. Well, it turns out she had a history of non-alcoholic fatty liver disease. And so what this causes is eventually it'll lead to cirrhosis and damage of the liver. But the number one cause of non-alcoholic fatty liver disease is being diabetic or having really high blood sugar. And she was never told of this connection. And we ran some blood work on her to start. And sure enough, she was maybe 2 or 3 points away from being diagnosed diabetic, but she hadn't been told that she was pre-diabetic. She hadn't been told that she was that close to being diagnosed. And this had been going on for years and years and years. You don't just become diabetic overnight. This is usually a issue that's been building over time. You become insulin resistant, then you become pre-diabetic, and then you become diabetic, right? So that can be 10, 15 years of progression of that condition. And you guys can look back at my webinar on blood sugar stability and balancing blood sugar. I talk a lot about that and diabetes and recognizing the early warning signs of prediabetes and how to reverse that. But this was her case, and no doctor, no GI specialist, no liver specialist, because she had a liver specialist also for her cirrhosis that was developing, told her this connection between her blood sugar, first of all, between her diet contributing to her high blood sugar, contributing to her fatty liver, and the liver is what makes bile. It makes bile, and then it stores it in the gallbladder, and the gallbladder has to eject and contracts and ejects it to break down fat and protein, like I said before. And so if we go upstream mechanistically, we already figured out we had to focus on her blood sugar to improve the health of her liver, to be able to better make bile, to then improve tolerance and digestion of fats. All right. So that was a very fascinating case. She responded very well to just dietary change and getting control of her blood sugar, improving her digestive systems. Here's another case study, and this case study really haunts me because this individual never actually started care with me. I consulted with him and his dad. He was a young guy, 25 years old, had been suffering for years with chronic constipation and bloating in his stomach that would trigger severe brain fog and fatigue for him. So all of his symptoms were largely neurologically based, coming from his gut. Remember, that's part of the brain-gut axis connection. Remember, the two systems are intimately linked together. And so I consulted with him. He explained to me, and it was like in my mind, it was a home run. He didn't tolerate carbohydrates and fiber. He did best if he ate meat. And if he fasted, he felt even better. And that is almost always classically SIBO, either small intestinal bacterial overgrowth or small intestinal fungal overgrowth. They're essentially treated the same way. And I spoke with him. I spoke with his dad. I told them, well, we can try to confirm this with certain testing, but I'm pretty confident this is what it is. This is what we would need to do. And for whatever reason, either they were skeptical, they didn't believe me, or they didn't want to invest the money in going through the testing. I don't know what it was, but they never ended up moving forward. And this case haunts me to this day because I was 100% confident I could help him and get him feeling better, but they just never followed through, unfortunately. And then the last case here to share with you, this was an awesome case study. This individual, we finished up her care earlier this year. She had been suffering with IBS, a diagnosis of IBS, for over 15 years since she was a kid. And over the 15 years, she saw many specialists, many GI workups. You've probably experienced the same or heard the same story. And it was always the same thing. IBS, there's no treatment for it. There's nothing we can do. You just got to kind of live with the symptoms. And her sister referred her to my office. We spoke about her symptoms. She was having a lot of diarrhea, a lot of cramping pains, just very unhappy, and had this bad relationship with food because she would eat certain foods and just feel terrible, and she didn't know what to eat anymore, and she tried restrictive diets and so on and so forth. Anyways, long story short, we did some testing, found out she had a fungal overgrowth in her small intestine, which had already penetrated into the bloodstream. So she had positive antibodies in the blood for a issue that was only supposed to be isolated into the gut. She likely also had bacterial overgrowth because she was having so many reactions to foods. Took us about maybe 6 to 8 weeks. We did a specific diet, some targeted supplements to help kill off the overgrowth. And within 6 to 8 weeks, she was feeling about 100% better. We did have to do some isolating. Certain foods definitely were triggers for her symptoms. And we were able to isolate what foods those were, largely processed and fried foods. French fries from a fast food place almost always trigger her symptoms. But we were able to fortify and strengthen her gut enough to the point where she was able to tolerate almost all other foods. Now, after we fixed this issue, of course, going forward for the rest of her life, she has to know that she has to eat a pretty whole food, healthy diet. Going back to old habits of fast food and junk and processed foods will again feed this bad bacteria and bad fungal overgrowth. Eventually, symptoms can come back if you fall into old habits. But once we taught her all this, once she understood, she developed a much better relationship with food and enjoys food and has no symptoms. All right. So before I get into the questions, if there are any, we do offer free 30-minute consultations in the office or remotely as well. You can text gut health to this number, 512-641-4500. If you text gut health, I'll know you watched this webinar and we'll set you up with a free 30-minute consultation, ideally in person. But if you're far away from Austin, we can do it virtually as well. All right, let's take a look at the questions. I see there's quite a few coming in. All right. So we have a first question. I have had IBS for 40 years. I have been taking a probiotic and Metamucil, and it has helped tremendously. What do they both do to help the imbalance of bacteria? Do you recommend them? So essentially, we're probiotic and Metamucil. Metamucil is basically a fiber. Both of them help support the healthy bacteria, help support a healthy microbiome in the gut. If they're helping tremendously, then keep doing it. And you probably need to incorporate more fiber-rich foods as well. All fiber-rich vegetables function as prebiotics, which feed the good bacteria in your gut and help them grow and outgrow the bad bacteria that may have grown. I hope that makes sense. Let's see what else we got. What do you do exactly for the gal with IBS? I broke that down already. You can actually hear her whole testimonial. It's on our YouTube page. If you go back, if I go back here, you can put our office name, For Healing Health and Wellness Center, into YouTube, and you'll see her video there. She kind of breaks down what she was experiencing and explains her experience. Let's see, let's go back for IBS. Now, I will say all cases of IBS can be a little bit different, but if you look at the symptoms of SIBO and the symptoms of IBS, there's like 80-90% overlap between the two. And so many times people come in diagnosed with IBS and we end up treating them as a SIBO patient, meaning they have a bacterial overgrowth. And so we'll use natural nutraceutical supplements to help kill off bad bacteria. And then we rebuild the lining of the gut and we improve the balance of the good bacteria with fiber or prebiotics or probiotics, so on and so forth, to strengthen and fortify the barrier system. I will say I don't have any questions on SIBO, but I tend to see a lot of patients with it. Most GI doctors miss the diagnosis of SIBO because if you do a colonoscopy looks completely normal. And when it looks normal, they tell you, oh, there's nothing wrong with your gut, it's something else. Remember, the most common way to diagnose SIBO is one, through symptoms, like I explained to the 25-year-old and his dad who came in, or through what's called a breath test, where they actually have you drink a certain formula. That drink feeds the bacteria, creates gas buildup, and then you breathe into a bag, and they measure how much gas is actually being produced in the bag from the bacteria. And that's how they measure that. All right, next question. What are your thoughts on hypnotherapy for issues with gut-brain axis? So I've been recently seeing ads on Instagram for this new therapy of a hypnotherapy for IBS treatment. If you look at what improves the gut-brain axis, activation of the frontal lobes, activation of the cortex in general helps improve what's called vagal nerve activity or vagal nerve output. And meditation is one of those strategies that can be used to do that. I would imagine hypnotherapy probably falls along the similar lines as meditation. Cold plunging also helps improve that brain gut axis. Exercise helps improve that. Manual massage of the stomach and the intestines. So visceral massage, finding a therapist that does that or doing it yourself can improve that connection between the gut and the brain. Gargling, anything that activates the back of the throat, like gargling, gagging, all activates the vagal nerve output to strengthen that brain gut connection. All right. Should someone with chronic diarrhea take Metamucil or to build stools? That's a good question. To bulk stools. Remember, from a functional medicine perspective, we want to know, why do you have chronic diarrhea? Just taking Metamucil to bulk stools doesn't get into the root cause of what's causing the diarrhea in the first place. Remember the case of the 50-year-old woman I just explained. Her chronic diarrhea is being caused by non-alcoholic fatty liver disease, which was being caused by high blood sugar. And so another common cause of chronic diarrhea can be bacterial overgrowth. And typically those people do not tolerate fiber. And that could be veggies, that can be beans and legumes, that can be fiber supplements as well. So we'd have to, I personally would look to dive deeper. Sorry, it's been a long day. Dive deeper into what's causing the diarrhea in the first place. Okay, next question. Why does one get overgrowth of bacteria? A breakdown in proper mechanics of digestion, in the simplest terms. Remember, if hydrochloric acid in the stomach is designed to keep the stomach sterile from bacteria or infections, if we don't have sufficient production of hydrochloric acid, those infections can get into the small intestine and the large intestine. They can trigger secondary reactions of bacterial overgrowth or just an infection in general. If you overconsume carbohydrates and processed foods, you tend to feed bad bacteria and you'll get an overgrowth issue. Sometimes it can be a case of food poisoning that just wrecks the balance of your gut for months and months or years. Antibiotics can cause a total wreckage of your microbiome balance between good and bad. This is a notorious trigger for SIBO, is too much use of antibiotics. So there's various factors. We try to get down to what is the cause of each individual person's, but sometimes we don't know. We just know we have to treat it and then fortify and balance the symptoms. And then we got a lot of comments from my buddy Chris. Sorry you've got so many symptoms. We should chat. I can probably help. All right, that looks like that's all the questions for now. I'll give you another minute if anybody else wants to post another question or comment. We're coming up on 7 o'clock, so like I said, I want to respect everybody's time. Excellent. And so like I said, I'll be emailing out a recording of this webinar If you registered for it, you'll get an email by tomorrow. It'll also be posted on our website as well as on YouTube, so you can review or even share with other family members that may be suffering with chronic GI issues and haven't been able to find answers anywhere else. And as always, like I mentioned, we do offer the free 30-minute consultation. Reach out to us, shoot us a text, give us a call, or just follow my social media. I post a lot of free health education content on there as well. Sometimes I'll even answer your personal questions if you do end up posting a comment there. All right. Thank you very much, everyone. This closes out the webinars for this year. Feel free to send some feedback if you like. Maybe I'll develop some new topics in the future. Bye-bye.